Hello everyone, my name is Malvika Kulkarni and I am a clinical and sports nutritionist, CPT and yoga wellness instructor. We at CDMK Fitness have a primary goal of helping people achieve a better lifestyle modification through good nutrition, stress management techniques and exercise programs. We also aim to educate people on the right approaches to nutrition through understanding various topics. And one such topic that we are going to take today is about HbA1c. So let's talk about HbA1c. HbA1c or glycated hemoglobin is a blood parameter to check your 3-month average control over your blood sugar levels. As compared to a fasting blood sugar level or a postprandial blood sugar level, HbA1c acts as a more stable measure to check your blood sugar levels and can be monitored every 3 months. As our RBC production is renewed every 120 days, our glycated hemoglobin levels also reflect our 3-month or 120-day average control on our blood sugar levels. Now moving on to the levels of HbA1c. To determine whether a person is normal, pre-diabetic or diabetic, there are several ranges of HbA1c. A range below 5.7 determines that a person is normal. Between the range of 5.7 to 6.4 is the range of pre-diabetes, and above 6.4 is a diabetic range. Now when it comes to HbA1c, if you are in the pre-diabetic range, this is an excellent time for you to bring great control over your diet and exercise regime, which will help you take care of your blood sugar levels without the need of any medication. If you are, however, over 6.4 range and you are a diabetic, along with medicine management, implementation of nutrition and exercise regime will ensure that you can reduce your range over a period of time. Now coming to the nutrition strategies for lowering your HbA1c levels. First of all, understanding what affects HbA1c levels. So our glucose consumption, which can be achieved from all the carbohydrate sources like whole grains, vegetables, fruits, and all the refined flours as well come under this category of glucose rich foods. So these elevate your blood sugar levels. The rate at which they elevate your blood sugar levels can be determined by the glycemic index of that food, and the quantity in which they are consumed can determine the glycemic load of the food. Now, when we are trying to reduce the HbA1c level, it's important for us to try to reduce the glycemic index of the food that we are eating. Typically, when we are preferring whole grain based foods, this will reduce the glycemic index of the food, and addition of fats to our carbohydrate sources will also help reduce the glycemic index of the food. Also, addition of protein, which is again a very important factor and which is lacking in a lot of diets, will help reduce your glycemic index. Now coming to the quantity. As opposed to having a meal pattern which is primarily based on having mostly carbohydrate rich foods, if you are having a more balanced meal pattern with including more fibrous vegetables, whole grains and a compulsory side of protein, this will help reduce your carbohydrate consumption, which will in turn reduce the glycemic load of the food. So typically, if you are used to eating more refined flour based food, then you should make sure that you're having whole grain based ingredients and reduce the carbohydrate consumption or reduce this ingredient in your plate. If I have to explain this with the plating method, we need to bring certain changes, as in if you are having vegetable portion which makes quarter portion of the plate, try to increase the vegetable portion to half of the plate. Then the quarter portion of the plate can be comprised of whole grain foods, and the other quarter portion of the plate can be comprised of protein rich food, and of course healthy fats spread across the plate. Now coming to exercise portion of trying to reduce your HbA1c levels. The most important benefit that we need to understand when it comes to implementing exercise is its impact on blood sugar levels. Exercise regimes like walking, like strength training help to reduce your blood sugar levels and improve your insulin secretion, which in turn helps you metabolize the carbohydrates more efficiently, and in turn will lead you to have a better control over your blood sugar levels. Along with that, stress also can be a triggering factor for increased levels of blood sugar. So we also see people who have stress-induced diabetes. For this, controlling your cortisol levels is important. So implementing practices like pranayama, which involve alternate nostril breathing, Brahmari, which we call the humming sound, and Omkar will also be beneficial in trying to reduce your cortisol levels and as a result reduce your HbA1c levels. If you have any questions or if you would like to reach out to us, you can just drop us a message below, or you can reach out to us through our contact numbers. Thank you.